good afternoon to all our colleagues and all the attendees on the webinar, and a very warm welcome to this afternoon's Global Health webinar hosted by the Division of Human Nutrition. So I'm Lynette Daniels, from Senior Lecturer from the Division of Human Nutrition, and I will be the moderator of this afternoon's session. A special welcome to our speakers, as well as our respondent joining us from Delaware in the United States. And today's webinar, we will be exploring how food environments and food choices are connected. So we know that food choices are influenced by various factors on a personal level, and also that the food environment plays a big influence. And we will explore this further today in the webinar, and I'm hoping that we'll have some good engagement and good discussions. The recording, webinar will be recorded, so you will have access to it afterwards. And our program is quite full, so we've got 5 speakers. And we've allowed 15 minutes in the program for our respondent to comment, and then also 10 minutes for questions and answers at the end of the program after all the speakers has presented. So please jot down your questions as we go along through the different presentations, and then you will be able to pose your questions either in the chat room or by unmuting yourself. You'll be able to ask your questions to the relevant speaker at the end. For the speakers, I will also just indicate around about 2 minutes when your time is up. So I'll just have an indication of that for you so that we just stick to our time. Okay, so for our first speaker, I would like to introduce Professor Mbenyane. Professor Mbenyane is the head of the Division of Human Nutrition at Stellenbosch University. She holds the research chair in food environments, nutrition and health, and she also holds a PhD in nutrition as well as an MBA. So over to you, Professor Mbenyane, to provide us with your first presentation. Professor, you're still unmuted.
Can you hear me now?
I can hear you, Prof, and we can see the slide. It just needs to go into slide view. Thank you.
Good day and good morning to those that are in different parts of the world. I've already been introduced, and I'll be presenting on why food environments and why they matter for nutrition and health. This is my presentation outline. As a way of introduction, I'll talk about what the food environment is. Then I'll go to the second part of why it matters. Then I'll share some knowledge that has been generated by researchers and also my research team for healthy living. So, what is the food environment? It is defined as the interface that mediates one's food acquisition and consumption, and it encompasses the dimensions that we know of accessibility and availability. But moreover, we also talk about affordability, desirability, and convenience, and more importantly, marketing. Furthermore, it's about the physical presence of food. It is also about the proximity to food stores location and the distribution of these food stores, and also the types of these food stores and the type of food that they make accessible. So we also know, on the other hand, that food choice is an integral part of the social and economic expression of our identities. our cultural preferences and meanings, but it ultimately influences the intakes, the nutrient intakes, as well as health. So if we understand the drivers of food choice and how food environment impacts on food choices, then we'll be able to understand the manifestations of multiple nutrition-related burden of diseases, which is important for development of interventions. So we also in food environment seek to determine nutrition determinants that are linked to the multiple burden of disease, but we also talk about food environments and food choice systems and how they influence food choice and nutrition transition. So the food environment is not just one area. It has many facets, from the personal to retail. So you have, there's a food environment at the personal level, household level, community level, school level, local, and retail. And these are some that I have selected. The conceptualizations divide this environment into community and then the consumer environment. These two allow for drawing a distinction between the food sources within a community and what consumers encounter while inside their local retailers. The personal food environment includes affordability, convenience, and desirability, as well as access, the ability to access food. Whereas the external includes dimensions such as availability, but more importantly also the prices, the vendors, the types of products available, and the marketing of this. And these two domains, the external and the endogenous, they are interrelated. These are some of the examples of the food environments that you encounter on a day-to-day basis around us or in our households. And also, this is another level of the food environment that shows food production on your left, and then vendoring on your right. And this picture, it could be anywhere in the world. Now, we also have our famous fast food environment, where people make choices on acquiring food and consuming what they desire. So this is how powerful the food environment is. And then we have the retail food environment. That also, as I indicated before, you have it at community level, that is the locations of food, stores, the markets, or both. Markets, and this also includes the marketing, the billboards that are in front of us as we drive or we walk around. And then at consumer level, it's the affordable foods in the stores and the market, but whether these are healthy foods that when a consumer makes a choice will be healthy. So with the food environment, researchers have reported links between health and the retail food environment, both at community or consumer level. showing that depending on the types of foods retail shops available to people, they influence food choices they make and ultimately the health outcome. So the food environment that is healthy, we should have diversified foods produced so that people are able to make healthy food choices. We will have another presenter talk about how food production influences the food environment. The population should have information or knowledge. So we do need to have some guidelines on what is healthy food, although we know that people's desires are much more powerful than whatever knowledge they may have. We also need to have improved food systems. That includes the use of local foods, where populations have the ability to be in charge of their food. And we can't talk about the food environments for healthy living without talking about healthy lifestyles, as we see in the picture below. So why do food environments matter? Why do we worry about food environment? In South Africa, we know that children suffer from multiple burden of disease, under and overnutrition, and food insecurity. And with over nutrition and food insecurity, there's evidence that those children develop NCDs when they're exposed to an unhealthy food environment later in life. The adults are not doing any better. We suffer from, we suffer and we're at risk of many NCDs because we are overweight or obese, and this could be the food choices that we make. And some are also micronutrient deficient because they don't make good choices when it comes to fruits and vegetables. With this slide, I want to show you the work by Remens and Tenner et al. From 2017 of the diet items on your left, the foods produced, and the percentage of the available need based on the calculations at global level. And you can see there that the meat is way above. We have too much meat compared to what we have in the whole grains and the fish and the fried vegetables and fruits and milk and the nuts and seeds are lower. So the food production is also an issue there. So it has been shown that the socio-ecological perspectives of food environment and health-related behaviors are determined by the interrelatedness between the personal and the environmental factors. In a review by Caspia et al., they showed moderate evidence to support the causal hypothesis that neighborhood or local food environments influence dietary health, and indicated that factors such as individual preference for fast foods were responsible for some of those health outcomes. Other researchers that I've listed here have also shown that food environment and food choices are linked to health outcomes. So this is not a new topic. As early as the 2010s or 2017s, there were already researchers that have been studying, the most studied being the school environment, and the retail and the fast food environment. I think there's less reporting on community as well as the personal. I guess to research that is a bit complex. So Swinburne recommend, based on all this evidence shown by these researchers, recommend a framework to try and intervene on the food environment, that the framework must be at different levels, quasi-regulatory, and also including approaches that involve government-specified and government-monitored programs of retail food environment. We know that when it comes to food, the governments and the industry are always at loggerheads.
Prof, you've got 4 minutes.
Now, I think I'm left with 2 slides. My research team, also the chair team, we have done different studies. We have observed similar findings. Dietary diversity always comes out low, and we have seen that is influenced by the local food environment because people choose to buy what is available. We have also observed that the retail food environment and access influences what people choose to buy. Affordability and fluctuating food prices. But the geographic location, whether it's rural or urban, village, township, or city, also is an important community food environment that influences food choice. In conclusion, I would like to indicate that the dietary patterns are linked to the burden of disease. Many of us know what a healthy and sustainable diet is, but it's very challenging to make healthy and sustainable choices because of our desires. Food choices are complex, and we need to consider both the social and the physical environment, which have strong influence. And if we want to collectively switch to a healthier diet, as recommended in the Lancet paper 2 years ago, we need to make drastic changes, not at cosmetic level, but even in our food systems. That includes the modification of food environment. I want to acknowledge my research team in the DST, Department of Science and Technology, and the NRF for funding the chair. I thank you, and these are the references that have been used. Thank you, Chairperson.
Thank you so much, Prof. Manyani, for setting the scene for us. I'm gonna go over to the next speaker, and also just a reminder to jot down any of your questions. You're welcome to also use the chat room for that. So I would like to introduce our next speaker. Our next speaker is Thembekile Dlamini. She is a member of the research chair in food, environments, nutrition and health. She holds a master's in public health, and she's now a lecturer at the Department of Public Health at the Sifaku Makhatu Health Science University. So the title of Thembekile's and Ms. Dlamini's presentation is on the slide, so I'm going to hand over to Ms. Dlamini. Thank you, Thembekile.
Okay, thank you. Good afternoon. Are you able to see my slides?
Yes, we are.
Okay. So for the sake of having a strong connection, I will just show my face and I'll present with audio alone. So good afternoon. As I said, I will be presenting and then I will switch off the video just so that I can have a strong connection. Thank you. As I have been introduced, I'll be looking at nutrition in an uncertain future. What do we know about the effects of climate change on food and nutrition security? So Professor Mbengene spoke to food environment and why it is important for health. And part of the domains that she presented speaks to availability, accessibility. So my presentation will build up on that. So, okay. Am I not? Okay. Yeah, so in terms of food and nutrition insecurity, climate change has been seen as a major driver, which is actually increasing globally, especially in the past 6 years. The foundations of our human health and well-being are affected by climate change due to the increasing worsening impacts. And when these impacts happen, then they increase the vulnerability that the world's population to concurrent health threats. So what happens is that there is likelihood and severity of this threat to simultaneously complicate the containment of these threats. These trends, I don't know how to hide this, it's disturbing. Okay, thank you. I was able to do that. Yeah, so these trends have a substantial impact on the infrastructure and supply chains, and you will see as you go ahead that how much climate change is actually having a negative impact on infrastructure and supply chains. And we will see that as climate change and environmental degradation continue, there are infectious disease outbreaks that have been happening, and they are still anticipated to increase in frequency, which will make disease control initiative to be challenging. So those who live and work in communities at a heightened risk of climate-related harms, they remain at risk. Just to link what I am presenting to Sustainable Development Goals, we will know that there's 2030 Sustainable Development Goals agenda that was adopted by many countries and with goals and targets. And from there is an inclusion of zero hunger, sustainable agriculture, and climate action, which speaks to the presentation now. So the second SDG goal of zero hunger, it aims to end hunger and all forms of malnutrition. And it is also committed to universal access to safe, nutritious, and sufficient food at all times. And we will understand how this it's actually being distracted by climate change. There's sustainable goal number 13, which calls for action to combat the climate change and its impact. And climate change poses a greatest risk to this towards the achievement of these goals. So beyond the SDGs, we have our own South African National Development Plan 2030 as well. So in that development plan, it was shown that the poor and vulnerable continue to be disproportionately affected by climate change. And it was also part of the South African agenda. But also it was showed that they also showed that rural areas experience different challenges to urban areas in many cases. So it is the poor who are vulnerable to climate change effects, which with more research, I think we will see that that might be changing in terms of the urban poor. So looking at the relationship between climate and food and nutrition security. So food and nutrition security is when all people at all times have physical, social, and economic access to food of sufficient quantity and quality in terms of variety, diversity, nutrient content, and safety to meet their dietary needs. and food preferences for an active and healthy life, coupled with sanitary environment, adequate health, education and care. Just by looking at this definition of food and nutrition security, I think everyone who is in this webinar can see where they fit in terms of food and nutrition security. So when this is affected, it means all the other aspects are also affected. Education is also affected, and the WASH is also affected. So the pillars that we're looking at is availability, accessibility, utilization, stability, sustainability, and agency. So when you look at the environmental changes that are occurring, they do affect all three major determinants of food and nutritional security, which is the availability, access, and utilization. And we will see how that is, it will be shown by the studies. So there's also evidence that show that climate does affect the quality and number of crops planted and changing the nutritional value and diversity of food available. So people do not eat food because it's their choice. They eat what is available. So the fluctuations that occur in the agricultural production does affect the income among food producers, and not only them, but also those that are employed under their sector. And this results in changing food prices, which food prices occurs in many times in this presentation, because I think you can relate that we, even in South Africa, we are going through all this increase in food prices and all. So this potential, all these factors have the potential to affect households' ability to access food through market mechanism because of the food prices and also their lack of purchasing power. And also the household ability to access food through the change in income that I have mentioned in the first bullet. It's actually becoming a problem for them, because once they lose their income, then their access is hampered. When we look at the food accessibility, the pillar of food accessibility, individuals and household, for them to acquire sufficient food. Food accessibility says that individuals and households must be able to acquire sufficient food to be able to eat healthy, nutritious diet, or have access to sufficient resources needed to grow their own food. So we cannot, because of climate change, such kind of things where we want people to grow their own food rather than depending on markets, it's actually affected. So access can be by affordability or by allocation. Where is it, and the political mechanism governing when and where and how food can be accessed by consumers and on what terms. So to deal with this, the response to food has physical and has to have physical and economic dimensions. We need infrastructures such as roads, where we'll be able to transport food from production areas to market centers. We also need these transports to also transport things that are needed to sustain agricultural production in the rural areas. In terms of availability of agricultural food also rely on activities such as processing, storage, and distribution of food locally, nationally, and globally. And even with increased food supply, it is uncertain if demand will be met, as we still have a lot of people who are poor and insecure because they don't have sufficient income to purchase food, and also availability is critical, is a critical condition for household and national food protection. But there is also inexpensive access to the food available.
2 minutes.
2.
Yes, that's great.
Okay. So looking at this food availability with access and stability. Climate change is putting food production supply chains, and access at risk. So the changing conditions affect the spread of crop and livestock pests and diseases that we have been seeing in South Africa. And increasing temperature also affects it also affects our sea animals. Yeah, I think I'm getting a little because I'm still far from finishing. So all these aspects, all these pillars of food security, food and nutrition security are actually impacted by climate change. So I just want to look at this slide where we speak to food use and malnutrition. Diarrheal diseases are the leading causes of malnutrition in children younger than 5. And when that happens, then the other infection can actually severely affect their nutrient absorption and utilization. And also that means their immune systems get compromised, that they can actually get other infections easily. And also the sanitation with the disease outbreaks. So in sustainability, I think Dr. Zuma will deal with sustainability, so I'm not going to say much on that. I wanted to come to the food and nutrition security in the SADC region, which has been reported to be still very high, and also that we still have about 55.7 million people who are still food insecure, and they will still continue to be going through this threat until 2023. And also that the child malnutrition is also in the SADC region. It's not only in South Africa, but in the whole region, we are actually affected. And not only children are affected, also the women in their productive age, they are also suffering from the iron deficiency and iron deficiency anemia. All in all, the prevalence of overweight is also in the upper, it's also considered high. Yeah, good nutritional status can only be realized and sustained when individuals within families and communities are food secure. So climate change does affect the nutritional status and dietary choices through its impacts on food security, diseases, water safety, sanitation, livelihoods, and caregiving. So the increase in climate-related disasters does have a direct adverse impact on food production and food security. Is my time up?
Yeah, it is up, Thembekile.
Okay, so yeah, there were a few slides that I had, but I will pause here. I will just go to the conclusion that saving lives in the face of climate crisis requires urgent, just and radical action. Governments that are most responsible for climate crisis must bear the biggest burden of repair. The future of nutrition is uncertain. So the question that I leave at this webinar with is, why do people eat the food they do? Which I believe that our next speaker will be actually breaking down for us. I would like to thank you.
Thank you so much, Ms. Dlamini, on a very important topic that you've covered. And yeah, we know that climate change is one of the biggest threats to global health. And it's therefore very much important that we need to engage a lot more on this topic. Okay, so I would like to then introduce our next speaker. Our next speaker is Busha Ngwenzakaye. She holds a master's in public health nutrition from Stellenbosch University, and she's also currently registered as a PhD student under the NRF funding, and she's also a junior researcher for the research chair in food, environments, nutrition and health. Thank you, Busha. Over to you.
Thank you so much, Dr. Daniels. As the preceding speakers have mentioned a lot on food environments and food choices, so I'll be presenting on the changes in food environments and food systems influence on food choices and nutrition transition, looking specifically at Limpopo province. So this is the outline of my presentation, wherein I will talk more on the study that I conducted in Limpopo, as well as presenting on the results, and also just highlight the key findings of the study and conclude. So this was a cross-sectional study wherein we were investigating how food environments and food systems influence food choices and nutrition transition in Limpopo province. And for us to be able to do that, 429 households from the 3 districts in Limpopo province, which are Mopani, Capricorn, and Bembe district, were systematically selected. And to get a good mixture, these households were from rural and urban areas, and mixing households from villages, townships, as well as towns. And the constructs that were measured are food environments, food systems, food choices, as well as nutritional status. And those where, for us to be able to do this, we used a validated questionnaire. And in terms of collecting data, we followed the safety regulations of the South African Department of Health, the World Health Organization, as well as the Stellenbosch University Health Research Committee. Coming to our results, I'll start with the anthropometric indicators of the household informates. The first one, it's the BMI status. As we can see here, that 36.2% of the household informates, they fell under the 3 classes of obesity, where in 20.8 of them, they were in the class 1 of obesity. And as Coyce and Day 2015 have reported that the prevalence of obesity in South Africa, it's on the rise. So the second one, under the anthropometric indicators, it's the waist circumference and the waist to hip ratio. Looking into our graphs here, the 2 graphs here, so this is males and these ones are females here. But it is visible that females here, when we talk of waist circumference as well as waist to hip ratio, we found that females, they were at risk when compared to their counterparts, as they had a higher waist to hip circumference as well as waist to hip ratio. And these findings are very much similar to what Shisana et al. 2014 reported. So coming to the biochemical indicators of the household informates, the first one is the blood glucose. The study found that 32.5% of the household informates, they were at prevalent of having diabetes. But then this study by Shisana, it reported a very lower prevalence of 4.2%. And the difference could have been our study, my study, we were using finger pricking testing, whereas the other study, it used the HbA1c testing. Coming to the second indicator, the total blood cholesterol under the biochemical indicators, we find that the mean total blood cholesterol here, as we can see, so we can see that here, many household informates, they had normal blood cholesterol levels, and only 16.8 and 3% of the informates, they self-reported as having heart disease and stroke respectively. And the third one under the biochemical indicators, it's hemoglobin. And only 10.4 and 8.5, 10.4 of females and 8.5 of males, they were at risk of being anemic. And another study by Statistics South Africa 2016, it also reported that there was a higher prevalence of anemia was reported among men as 17% and amongst women as 31%. Our study, found much lower prevalence as compared to this study. And the last one on the indicators, it's the clinical indicators of the household informant, wherein we looked in the blood pressure, we were looking on blood pressure. And then the graph here, we can see that it tells us that on the normal side, we can see that about the same percentage of males here, of females and males, they had the same percentages when we are talking on the systolic levels. And coming to this one at risk, both females and males, we can see that males, they were more at risk when it came to their diastolic levels. Moving forward, the food environment. So I will start with the community food environment. The graph here tells us that spaza shops, they outnumbered any other food stores in the communities. And 49.1% of the household informants, they reported that they did go out and ate at restaurants. And the second food environment is we focused more on the retail food environment. And it is evident here that we can see that almost all the food groups were sold in grocery stores and convenience stores. But then looking specifically on the food groups that were being sold by the street vendors, we can see here when we look at the processed foods, they mostly sold processed foods, they mostly sold fruits like your oranges, bananas, mangoes, lychees. And the last one, they mostly sold also vegetables. And the school food environment, here on the school food environment, we can see that only more than half, 57.3% of the children, they had their breakfast at home. And when it comes to lunch here, almost half, 44.8%, they had their lunch at home. So when we asked more on what children, when it comes to street vendors, what is it that children buy from street vendors? It was revealed that children mainly procured unhealthy food options, such as your sweets, crepes, fat cakes, amongst other unhealthy options. And the last one is the household food environment. So it is important for me to mention that this one, it was on the day of the interview, wherein we also observed the different foods that were available in households. And we can see here that the most available food groups, it was staple foods, meat products, as well as vegetables. And the least available were cakes, confectionaries, as well as alcoholic beverages. And coming to the food systems, thank you. Coming to the food systems, there was a clear indication that most households from the 3 districts, as we can see here, they depended more on home gardens. And dietary diversity of most of the households informants, it was low, as Professor Mbenyane had mentioned, that many studies that were conducted within the chair, they revealed that the dietary diversity of many household informants, they were low. As this study, we found that. And the key findings here in this study is that when we talk of the education level, the proximity to food stores, restaurant outing, and the monthly household income, they were positively associated with dietary diversity. So the more the person attained their education level, the more their diet became diversified. So the presence of food stores within the communities, they provided both an obesogenic as well as protective foods in the study areas that we focused on. And it is of utmost importance that I mention that affordability, it was an important factor in accessing foods in this study. And as I conclude, as I conclude here, food environments, they do have an influence on what we eat and also on our nutritional status. And Claassen reported that South Africa is undergoing a nutritional transition from the 1990s. And this is coupled by the consumption, wherein there's a high consumption of sugary, salty, as well as processed foods. And Blade et al. 2016, they also reported that South Africa also has the highest rates of overweight and obesity in the African continent. So the next speaker, they are going to talk more on how we're going to, how is it going to be possible for us to create sustainable food environments. So thank you so much. These are the references, and I thank you.
Thank you so much, Musha. And sharing your important research study of the case study of that you conducted in the Limpopo province.
Thank you so much, Dr. Daniels.
All right, so then we can move along to our next speaker. So our next speaker is Dr. Zuma. He is currently a postdoctoral fellow in the research chair for food, environments, nutrition, and health, and he holds a master's as well as a PhD in crop science from the University of KwaZulu-Natal. Thank you so much, Dr. Zuma. Over to you.
Good afternoon, everyone. Chair, can I also ask to switch off my camera so that I won't be disturbed? Thank you.
Okay. You can just share your slides with us.
Are they viewable?
It's viewable, just needs to go into that. Perfect.
Yes, good afternoon, everyone. My study will look at sustainable food production and its impact on food access and availability, covering what most of my colleagues have covered before. So the outline, we will have introduction, food production in South Africa, findings from the research chair, sustainable food systems, potential interventions, and conclusions. Well, we know there's a relationship between population growth and the demand for food. However, we need to make sure that we meet targets set by different stakeholders of ensuring that we produce more food for the growing population. The solution should then be sustainable food production, of which most countries, especially developing countries, have not met them. As we know that we have changed from the Millennium Development Goals, now we are into the SDGs, trying to ensure that we achieve the sustainable food production globally. However, it still remains a challenge, especially in Africa. In South Africa also, this is a challenge because we have not met the target by the country of ensuring that we produce sustainable food production at all levels. However, challenges like this are caused by poor access to water, financial implications, climate change, COVID-19. As we saw that during the pandemic, we had many issues arising globally. Wars such as the Ukraine-Russia war, which has increased the farming inputs. As we speak now, farmers are complaining about the 300% increase in fertilizers and some other chemical inputs that are used for farming. Then we also have an issue of pest in South Africa that we are very challenged with, especially at smallholder farming level and also at subsistence farming level. These arising challenges have been a hard issue for South Africa to deal with, and also other sub-Saharan countries, which has also led to food insecurity existing at household level. So in South Africa, food security is termed to not exist at the national level. However, it exists at household level. So it is my thinking that these are the challenges, and also if we cannot have sustainable food production, then we will suffer or will struggle to deal with this. In South Africa, we produce food at different levels, ranging from commercial, smallholder farming, emerging farming, subsistence farming systems. So these skills target different groups and also different markets and different value chains. To highlight a bit, commercial, we've more focus on supermarkets, exports, and more into formal market. Smallholder and some emerging farmers, they focus sometimes on formal and informal, such as your street vendors and your tuck shops and your nearest accessible shops. At subsistence level, then we focus at household and community levels. Your one home garden and your community garden that has a potential to produce healthy food. So I believe, and some others believe, that subsistence farming can contribute a lot in terms of ensuring that we produce healthy foods, because that is when we can easily control. The reason being is that at commercial to smallholder level, the main focus is on cash crops, and these cash crops are more about the value chain and the value, what Pick n Pay wants, what other big supermarkets want. So the aim is to deliver there. The reason could be that we want to make profit, and we want to make sure that the production system keeps on working on and going on. The other issue is that at a commercial level, farmers are changing. They are no longer producing more veggies, so they are diverting to macadamia. This could be because of cost, because of other issues that arises. Some are into sugarcane. If you move around South Africa, you'll see many fields, and you ask yourself that if we are food insecure, but then we have so much field with sugarcanes and hectares and all those things, hence the market of sugarcane is no longer doing well now. We saw after the lessons received or the government allowed for cannabis to be planted, everyone, even us as researchers, we moved to cannabis this, cannabis that. So many food production systems or farmers have or are moving out of the vegetable production or food production system to cannabis. These remains a major challenge within the commercial sector. And also, sometimes human or food production for human competes a lot with livestock feed production. If you drive around Northwest, some other provinces, Free State, you will see that we plant a lot of hectares of maize, but then for animal production and also to feed our animal. Some of the food, I think the next speaker will touch on, goes to waste. We have high food waste in South Africa. This could be caused by maybe market issues, pests, like I've said before, some other issues, inability to access market, or issues that arises with the produce also. So now, the issue here is, as much as that is happening, we are producing so much food at a higher level, but South Africa, or post-COVID or during COVID, we saw that many people realized that there is need to have a garden, or there is need to produce at a community level, and also the government focus has been to make sure that subsistence farming keeps each and every household rich in terms of food. So the dependency on subsistence farming has grown over the years. However, due to urbanization, people have moved to urbanized areas where there is limited space for food production. Hence, there is the failure of one home, one garden. So me prioritizing having flowers rather than having food. Others prioritizing having swimming pool rather than having food. So these are some of the issues that we are faced with in terms of production in South Africa. So the research team has presented. So I will just touch on a certain few things that needs to be looked at on. Our findings have shown that we have the presence of hunger, presence of food insecurity in some of the communities that we work on. There's low consumption of healthy foods, because the aim here of trying to achieve the sustainable food production is to make sure that you have not just food for the sake of feeding your system and everything, but then you try to ensure that you fight the triple burden by ensuring that we produce more healthy foods. But in these communities we work around, we saw that they consume less of nutritious food, fruits and vegetables and nuts. So it's more about meat and all those things. Also, the food environment around our schools, our household, the geographic locations plays a huge role. Especially, for example, here in the Western Cape, there are foods that I cannot find. There are foods that I need to go to KZN and be able to get them. So the question is why? And also the nutrition transition, that people after urbanization, we have moved away. We are more into ordering foods, using Uber, making sure that we'll eat less of the good healthy foods. So those are some of the issues that we know. However, the vulnerable group remains children, women, and elders, not men. So the aim is to achieve sustainable food system, which will enable to fight against food security and supply good nutrition, to fight against malnutrition in a way that we create economy, good for social impact, and also ensuring sustainability among the environment, so that the near future is able to have food, is able to access nutrition at various forms. The interventions that we propose is that
1 minute.
There must be health and nutritious food produced at all levels. We must stick to climate smart agriculture, improved production of underutilized crops, improve the consumption of indigenous crops, ensure nutrition education amongst all. Preservation of food is very important. Teach people about utilization, ensure that food is available. Integrate biofortified foods into our diets and in our feed also. Develop market for women to sell and produce their indigenous food. Also, for those in different geographic space, then we need to try with the new ideas of creating aquaponics, which then give us vegetables and also fishes and all those things. So these are proposed interventions. In conclusion, what then now the government needs to do? The government can also invest back and look at improving the country's policy on food production, focusing on health food, because the issue is not only about just producing food, it's also about ensuring that we produce health food. Large scale should investigate producing some foods, not just focusing on cash crops, not just on focusing on macadamia. Maybe there must be something that needs to be done to ensure that we produce food for the sake of people. Support smallholder farmers and emerging farmers, ensure that government is still there for sustainable food production, employ climate change policies for sustainable food production. I thank you.
Thank you so much, Dr. Zuma, and for including your conclusion and the proposed interventions that we need to explore as a country.
Yes.
Just a reminder to post any questions in the chat room. You're welcome to do that. Okay, so I'll introduce our next speaker is Professor Rina Swartz. However, Professor Swartz is traveling in remote areas, and we realized yesterday that connectivity would be an issue. So therefore, Professor Swartz agreed that Prof. Mbanyani may present her presentation on her behalf that she has prepared for us. I'll just firstly read Professor Swartz's bio before I hand over to Prof. Mbanyani. So Prof. Swartz is from the Center of Excellence in Food Security at the University of the Western Cape. She holds a PhD in Public Health from the University of the Western Cape, as well as an MPhil in Public Health. She is based at the Department of Dietetics and Nutrition at UWC, the School of Public Health. And as mentioned, she is in the Center of Excellence in Food Security. So I hand over to Prof. Mbanyani to present Prof. Swartz's presentation.
Thank you, Chair. Chair, can I have the first slide with the... Yes, and I'm presenting on behalf of the team that you see there. Second slide. So the presentation will be a brief overview of waste pickers, who they are and what they do. And I'll report on the research team's findings that will cover the nutritional status of the waste pickers and dietary intake, as well as the occupational health hazards. Next slide. So there are different types of waste pickers. And another word that is used for waste pickers is reclaimers, because they are not all the same. As you can see on the slide there, you have those that pick up food in the sites. We have those that pick up food on the street, and there are also the scrap metal waste pickers. So most of them, they specialize in a particular area. And the landfills are found in most towns and cities. And most of them have got waste pickers that depends to some extent on them. But the local authorities benefit from what they do because they, to some extent, on waste management. Sometimes they also time the dumping by the trucks that dumps food from the big retailers and so forth. So they next slide. So there are two sources of reports on the economics of waste. One reported by Linda Godfrey from the CSIR, and another one by Hoffman and Schenk. And as you can see, they show the chain that you have the primary collector, the secondary collector, and how the chain, the food chain works, and the value that brings. The next slide. The next slide, there's also another study that estimated that potential value of waste as a resource could be as high as 50 billion. However, at the moment, about 8 billion is extracted if fully utilized. Next slide. So the research findings will report on what is generated in 9 landfill waste sites in, I think it's 5 different provinces, in 4 different provinces. And they observed about 373 landfill waste pickers. The aim of their study was to investigate the food security, nutritional status, and socioeconomic status of waste pickers. They also explored the health challenges of waste pickers and used, next slide, cross-sectional triangulation. Next slide, I passed the objectives. Yes, they used a cross-sectional triangulation with mixed methods, where they had process A looking at the socio-economic, using both quantitative and qualitative. And then the second part was the nutritional component. And they indicate that the 373, I think it's the next slide, represents 67% of the waste pickers present at the sites on the day of data collection. Next slide. Okay, the previous slide also shows the provinces where they did this research, which was Western Cape. If you can go back, there's Western Cape, Free State, Northwest, Gauteng, and a little bit of North Rand. The next slide shows the definition of food environments, as I indicated at the beginning, that you have got the external and the internal environment, and the dimensions that influences whether it's external or the personal one. So on 11, next slide, they said that 50% of them reported that they collect food from the land sites. For at least 28%, and 28% said it was their only food source. The images on this slide provide some indication of the food collected. You can see the SSBs and some other food items. And then they also indicated that not only do they get food from the landfill site, but they also get donations from restaurants or hospitals or churches. And some of them indicated that they've got some cooking facilities. So sometimes they cook there if the products are raw. Next slide. So this is the food chain, and they indicate how food loss occurs on your left, and then on your right you have the food estimated food amounts, which amounts to about 45% of all food produced by the country.
3 minutes,
slide. 2 minutes.
3 minutes.
The next slide is about a dietary diversity. They also found that they were low, and that some of the foods that they were actually eating was polony was the most, and the SSBs and some sweets. And next slide. You saw the dietary diversity before, and then nutritional status. It depicts what we normally know, but the females were also overweight and obese, and that slide also compares with the South African demographic health survey of 2016. The education level, which is the next slide, shows that they didn't have a lot of training, and therefore did not find jobs. 17. The next slide shows the reason. They were, agents, the reasons for getting into the waste pickers things. You can see this cannot find job or earn income for the family. Next slide. Most of them had been in this work for between 5 and 10 years, and they had dependents, and of which at least 2 were children. The next slide, the hazards. The next slide will show us the hazards, absence of basic water and sanitation facilities on the landfill. They also reported injuries that can be caused by sharp objects that are dumped on the side. The next one were There were also reports of tensions and occasional fights. Females reported that they are at risk of rape, especially on the entry in the Northern Cape. And then substance abuse as well. They also said that some companies dump glue, and then that becomes a problem. We can go to the next slide. So the health problems that were reported were respiratory, nature, dermatology, substance abuse, mental, access to TB, HIV, and NCD medication. The next slide, I think. Prof. Rina indicate that if any of us have interest in waste pickers, we should be contacting the chair, Strategy Chair in Waste and Society at UWC, who is Professor Ridi Cheng. And then she would like to also acknowledge the next slide, the contribution of the Center of Excellence in Food and Nutrition Security. Next slide. Is the end.
Yes, it was the end.
So I want to thank you on her behalf. I hope I have done justice to her presentation. Thank you, Chair.
Thank you so much, Prof. Banyani. Okay, so I'm just looking at time, so I think let's move on to our respondent. So our respondent is Professor Setilane. She has a PhD from Tufts, and she's a professor of nutrition in the Department of Behavioral Health and Nutrition at the University of Delaware. Thank you, Professor.
Thank you, Prof. Daniels. So good morning, everybody, or good afternoon, depending on where we are in this world. So my name is Kilebogile Setilane, and I'm Professor of Nutrition at the University of Delaware in the United States. And I'm very happy to be able to participate in this very important topic about how food environments and food choices are connected. And the research is very important, as we all know, because good health is required for economic and social development, and nutrition, our very own nutrition, plays a major role in promoting both the good health and overall quality of life. And I think that the papers all encompass this quite well. The overall goal of why food environments and food choices are connected is to improve food environments so as to influence the improvement of the triple burden of malnutrition, which are undernutrition, micronutrient deficiencies, and overnutrition. And some of the papers brought that out quite well. And it was particularly mentioned in the first presentation, which gave us an overview and definitions of what food environments are and the factors that influence food choices and distribution in the household. We learned that the food environments influence what foods we are going to acquire and consume. And we can also look at the different contexts of the food environment in order to investigate why people's food behavior is the way that it is. In other words, why people eat the foods that they do. We learned that the food environment takes into account those external or community factors like availability, price, vendors, product properties, marketing and regulation, and also the personal factors like accessibility, what is desired, and what is convenient. So we looked at the different examples of food environments presented, like the retail food environment, which is where the food is located in terms of food stores and markets, and the types of food found there for the consumer. Things like fast foods were mentioned. And we had studies that shown, studies were shown which show the impact of the neighborhood food environment and its impact on the dietary income of the consumer. and how these factors influence food choices. I thought it was also interesting, not so much was brought up about, but also very interesting, the factors like social and cultural influence and tradition, and all of these, of course, have to do with our identity, and they influence the types of foods that we eat, and therefore the nutrient intake, and which goes into the health that we have. And all of these are extremely important. Also important, looking at how people in the households acquire, store, prepare, distribute, and consume foods. And that's very important because it will influence healthy living, like things like food and nutrition security, the health and dietary patterns, production of diversified foods, and also the use of local and indigenous foods. Let me now go on quickly to just to summarize a little bit, the article on the climate change and food security. I think it was important. I mean, I think we all now realize how climate is very related to food and nutrition security, and is actually one of the biggest threats to nutrition. I like the way that the effects of climate was brought up, in that it affects the food and nutrition security in different ways. It affects, particularly in the food and agricultural production, because that affects the food producers and the ability to produce the food, and that of course affects the food prices, and that then affects the household's ability to access food, and then that again goes to you know, comes into the health and infectious diseases, diarrheal diseases, particularly in young kids, and also how rural areas experience the climate change differently to urban areas. The presentation on the changes in the food and environment and food systems affecting food choices. It was a cross-sectional study, and it did a good job of using the case of Limpopo province as an example of how these changes in the food environment influence food choices and the nutrition transition. We learned that the study was from a population of rural and urban areas, and the socioeconomic, the probably lower on the socioeconomic scale. More than 50% of informants earned less than 5,000 monthly. There was an outline of the nutritional status of the population in terms of measures that are risk factors that contribute to the burden of chronic diseases. So measurements like BMI status, waist circumference, blood glucose, and prevalence of diabetes, blood cholesterol, and measures of anemia, the micronutrient deficiency were collected. She also showed a distribution of different food groups found in the different types of food retail stores, which looked into the community food environment, and found that the spaza shops were used mainly for supplements, and even though they did outnumber the supermarkets, the people did also go to the more formal retail stores and use those for their monthly groceries. Lots of staple foods sold in the convenience stores. It was interesting that fruits and vegetables and processed foods were sold in all stores within the communities. I also thought that it was interesting that most households in the towns and the townships utilized home gardening for their vegetables and their maize. In fact, we learned that 12.4% of households reared chicken and other livestock like rabbits. Although in the other paper, we also learned in the next paper by Dr. Zuma that probably could be increased. The dietary diversity, 48.4 had low dietary diversity, and only 24.3 had excellent dietary diversity. So that number 24.3 was kind of low, but it is associated with better health and improved health. I also thought it was interesting to look at the school food environment, because this would be a major food environment affecting children. We learned that a high percentage, 79% of the informants indicated the presence of food facilities at school. The study found that 57.3% of children had breakfast at home and 34.8% took lunch to school every day. And I think it would be interesting to find out what food they were given for breakfast and what food that did they take for lunch to school. But we also learned that most of the unhealthy foods were from street vendors. And again, we're told that most within the household food environment, most of them brought 97.8 from grocery and supermarkets, and very few brought their food from convenience or spaza shops. Dr. Zuma looked at food production and sustainability and its impact on food access and availability. And he looked at some interventions that might be useful in sustainable food production. He also looked at the challenges to sustainable food production, and we learned that they range from the environmental to the COVID, to the wars that are in high profile right now, and of course the financial well-being, which all of these things lead to food and nutrition insecurity at the household level. And that there's a wide range in terms of the scales of food production in South Africa, which range from the commercial to the substances level. And we see a high presence of hunger, low consumption of fruits and vegetables and nuts, and this results in health that's affecting the vulnerable groups of children, women, and the elderly. I was interested in some of the interventions that were brought up here in substance farming was one that was brought up, which I guess could also lead on to improving the production of indigenous foods and developing a market for women to sell produce and indigenous products. Also adapting to climate changes that we are undergoing by using climate smart agriculture. And then of course, our very own nutrition education. And I would think that nutrition education, which is culturally relevant, would be important too. But I think a very important intervention mentioned was one of government policies on food production, that they should focus more on healthy foods. And then the final paper on food security and the health needs of vulnerable groups was I thought was very interesting, as it looked at a vulnerable group that we do not often look at in studies, those of waste pickers, who are the poorest and the marginalized in society. We learned that waste is an unavoidable product of human activity, and it can lead to the degradation of the environment and health problems if it accumulates in large amounts. And that South Africa has generated really large amounts of waste in 2017. Much of the waste, though, was recycled, but some of this waste included food. I thought learning that waste picking, the waste pickers significantly contribute to the economy, particularly the recycling economy, was something that is not often brought out. So they are also valuable. They have a valuable contribution towards waste management and recycling. But above all, waste picking is a strategy towards poverty alleviation. Those who are waste pickers are people that are really very poor, often the bottom of the society, and they use the strategy of waste picking to collect, sort, recycle, and repurpose and sell materials thrown away by others. And so I thought this was really a good study where there was a collection of quantitative cross-sectional data from the waste pickers, and it ranged in the geography. You had 6 rural towns and 3 urban cities, and within 4 provinces, and you had about 409 people that were interviewed, and they looked at several things, including nutritional status, dietary intake, and dietary diversity, which they found was low. Yeah, I think I'll end there, and thank everybody for wonderful presentations and for inviting me to be a part of your webinar.
Thank you so much, Professor, for your insightful comments on the papers and just bringing everything together for us. I see there is, we've got about 4 minutes left, and there's 2 questions from Prof. du Plessis, one directed to Prof. Mvunyaneni and one to Thembekile Dlamini. I see Professor Mvunyaneni has responded to Prof. du Plessis' question. Ms. Dlamini, are you able to respond to the question? Would you like me to read it out, or are you able to see it?
I'm able to see it. Thank you, Chairperson. Thank you, Prof. du Plessis, for the question. So my response to you would be that climate action does not just require government alone, but it requires different transdisciplinary collaborations, all that are important in responding to the climate crisis that we are faced with. But government, I've mentioned government more because they are important in their facilitation in terms of whatever programs or policies that are put in place to deal with climate change. They are supposed to be the ones who are delegating, who is supposed to ensure that all those documents or all those plans that are put in place get implemented. So I think I would have responded to that if I did not rush for time, but it's quite important that everyone actually is engaged, especially in terms of actually implementing and tailoring their own adaptation and mitigation efforts, depending on where you are, because not everything should be the same. And also with us in academia, we are equally important in conducting the research on climate resilient, what are the alternatives and all that. Municipalities in the setting in South Africa are equally important in addressing their climate vulnerability through their support programs. So I think I will end here, but yeah, I could say a lot. Thank you.
Thank you so much, Thembekile. Is there any other questions from the attendees? We still have about 2 minutes left for questions. Okay, so I'll give it just a few more minutes. Otherwise, I will end the webinar and just firstly thank all the speakers, and especially Professor Satelani from our respondent for your participation and your input in today's webinar. Thank you also so much for the questions that was posed, and I hope you found the presentations and the comments insightful and helpful and informative. So with that, if there's no other burning questions, I would then like to end this webinar and just to thank everyone and have a good evening further. Thank you so much.